So, hello everyone. Today I present Salivate, a revolutionary gum that can predict diabetic foot ulcers before they even occur. Mm, So, coming to the problem statement, India is home to over 77 million diabetics. According to the rule of 15% of them develop diabetic foot ulcers and 15% of them lose their limbs due to amputation. This leads to disability, reduced income, and a significant lower quality of life. So, with current detection, either it is invasive or too late. So, we are changing that. Scientific studies show that the certain biomarkers like CRP, IL-6, tumor necrosis factor alpha, and MMB8 rise in saliva before DFUs even appear. Using this, we created a chewing gum embedded with gold nanoparticles tagged to antibodies. Just chew, and the color change will indicate diabetic early inflammation, a warning sign for diabetic foot ulcer. So this is how it works. The patient chews gum, the saliva interacts with these antibody nanoparticle complexes. If intermediate markers are present, they trigger a visible color shift from red to purple to blue. Coming to the technical feasibility. Technical feasibility, this gum includes uh, a stable base. These are the relevant data and values. And as we spoke about the basic principle behind, let's see about the colorimetric change assessment factors. And you can see that the sensitivity and antibody chemistry, these tests are very sensitive. So we can detect these markers even at a very low picogram to nanogram per ml range. These are the colorimetric changes which are expected. Like if the color changes from red to these are the colorimetric changes which are expected. And if the color is red, then there is no risk. If the color is purple or violet, there is moderate aggregation, which means there is moderate risk. When the color is blue, it is strong aggregation, which indicates strong high marker levels. And coming to the composition and design, here is the composition of the gum. We are going to make it in uh, three parts: a stable base, which provides a chewable matrix that activates with saliva, without interfering with the detection chemistry. And coming to the biosensing core, this is the active biosensing unit where gold nanoparticles are embedded. We are going to add some conjugation stabilizers in order to keep the antibodies stable and improving the shelf life. And this is the micro encapsulation matrix because without micro encapsulation matrix, the stability might be lost and there won't be control release. So we are using hydrogel or polymer based microspheres. Coming to the clinical workflow, basically the patient comes in the hospital or wants to check his diabetic foot ulcer risk. He will chew the gum. He will observe this color change, and he will put that color change into our Diavin app, which is a personalized app, or he will contact the nearest ASHA worker or PHC worker who will read the result and categorize his risk. And he will educate the patient and follow up the patient accordingly. And coming to the scalability, in the next slide, I'm going to give the estimated cost in large scale production. We can also partner up with pharmaceutical companies and medical startups to produce these on the contract basis. Yeah, these are the resources which we might need. And coming to the next, this is the estimated cost per unit. We are estimating at a 13.3 rupees per unit cost. Average like giving the nominal cost and output of the patient, we can ask the patient to chew this gum twice in a week. So thus a monthly expenditure of 120 rupees is expected in India. So which is a nominal cost, and in completely rural areas where there is less spending per month, the government can provide these gums at a subsidized price. And coming to the challenges which we need to take care of in here is because these given markers are also linked to oral cancer and periodontitis and diabetic retinopathy. So it's like hitting three birds with one stone. Whenever you find that the patient is at risk for all these three, he goes to the patient PHC and he gets checked for all the three. And the other is when, where, and how. Gum can be used at any level of healthcare, from the home self-care assessment to the PHC level. It can be used everywhere. And we need to understand that this can also be a screening tool for adherence to medications and lifestyle modifications because it doesn't it also shows the systemic inflammation markers too. So And we can how a simple choose solves the problem of diabetic foot ulcers early detection. Coming to the key stakeholders, these are the key stakeholders as we know. And buying strategies, we are going to introduce this gum in a culturally acceptable manner because not everyone will be interested in taking care of themselves unless there is a visible outcome coming out of it. So most of the people feel India is a culturally and deeply religious country. So we are going to use culturally active groups and religious groups to distribute this gum at a nominal price of 15 rupees using Diavin. And Diavin is also tailored according to the patient's religion, and it also incorporates cultural beliefs, aiding them to maintain and continue drug adherence and lifestyle adherence. So we are going to make an ecosystem where the patient detects and also keeps in the positive feedback loop of good maintaining health, positive health, good lifestyle adherence and drug adherence. We can use the existing cultural frameworks like this and ensure that our product goes and its services go a long way. So the business model which we plan on making to use is public health partnership because it would make an ideal choice to bring a great change in the society. And our vision is to make a pilot with 1 lakh patients in Tamil Nadu. And later on, we can get the biomarker and outcome data, and then expand to 1 million beneficiaries along with integration with the Diamond app usage. And we can integrate it with Ayushman Bharat Digital Health using the Diamond app. So these are our references. So thank you, and let me introduce you. So let me introduce you Diavin. Diavin is our personalized healthcare companion app. So we have established the basic idea of diabetic foot ulcers and diabetic prevalence in the first video. So it has been found that the risk for diabetic foot ulcers is highly influenced by the lack of hygiene, addictions, and dietary changes too. So using this, we can reduce diabetic foot ulcer and diabetes complications by doing what by following this. So stress is a potential contributor to chronic hyperglycemia and diabetes. Patient education is also lacking. So the interventions which we can do are we can improve the patient's adherence to the lifestyle modifications, help the patient to interpret and analyze the results from salivate, help the patient to understand his disease state in his language, and we can intervene by like this. So we are going to do this using Diavin app. So we can monitor the patient's daily activity using Diavin. We can promote patients' adherence towards the better health and lifestyle choices using reward mechanisms by promoting their patient's drug adherence and by providing instantaneous feedback on how patient has improved his disease state following the app. So technical feasibility, Diavin is a hybrid digital health ecosystem. We are going to use a software and a hardware. Hardware is Salivate, which I explained to you before, and the software is a gamified mobile app that promotes the lifestyle change and behavioral nudging. Modular background. This is the user, these are the modules which are going to use. We are going to make a user profile and stratify him according to the risk. Based on we are going to ask the patient to fill the forms in which we assess the patient's motivating factor, diabetic status, and weight and lifestyle. And then we are going to assess his risk, and we are going to track his lifestyle, daily inputs of steps, meals, blood glucose, stress, and sleep. And using this, we are going to predict his risk for future diabetes complications. And you are going to use gamification engine where we convert healthy behaviors into points, streaks, and levels. And we are going to give them experience points, badge displays, rewards, and logic. And we are also going to integrate a motivational AI coach, which uses the voice of someone they love or which uses the voice of the religious figure which they worship more. So this nudges the user with daily personalized goals, wins, and reminders. We can use this to bring a significant change in the patient's lifestyle. And we know that India's most of the population is a rural population and they care more about money. So when we tell them that they are saving this much amount of money by doing this behavior, they get more motivated. Using that as a principle, we are going to help them in a positive feedback cycle. And coming to the health education, we are going to give them micro lessons, regional level language videos, and quizzes. And we are also going to integrate this with salivate. So the patient is going to chew and he is going to take an image of the gum, or he's going to input the color of the gum in the app, and the app recognizes his risk and informs the nearest healthcare facility or the PHC about his risk too. So this is the diamond app design where the patient onboards, patient is given daily tasks, and if he's completing them, then his risk score is given. His lifestyle tracking is done, and there is a separate module for salivate. And then there is education hub where he'll get educated. And then there is financial motivation area where let us assume the patient runs every day. So by running every day, he's going to save 3,400 rupees in the future. We are going to give feedback in this way and keep the patient motivated to be in the positive lifestyle changes. And we are also going to give him the option to have a community and challenges too, because peer-led motivation is also a significant factor in Indian population to follow healthcare behavior. And this is the clinical workflow where the patient gets diagnosis of diabetes. He'll install the app, he'll fill the data, and he'll do daily monitoring of diet and activity, and he'll keep updating the test results of the in salivate. And in cases of high risk, the app notifies the nearest health center and the patient too, and so the patient will seek the healthcare and mitigate the risk as soon as it is possible. And this is the cost associated. For making a minimum viable app, we need around 28 to 30K. And the business model which we intend to use are business to government model. But here we are going to pitch the idea with government, and the government will pitch its preventive health initiative for its employees, and then scale it up to mass production. Then the government pays the bulk license fees for us. And limitations and mitigation strategies are the user mistrust about do-it-yourself diagnostic tools, and to mitigate this, we are partnering with local PHCs and ASHA workers to enhance initial trust establishment. We are also going to use to beat low digital literacy. We are going to use simple user interface, regional language integration, and voice-based navigation. So these are the target population and the buying strategies. As you can see them, you can understand them very easily. And the buying strategies, it is known that India is a deeply religious country, and it has also been proven that healthcare when associated with religion is culturally more accepted. So using this, we are going to dispense the salivate and diavin, and we are going to promote this. The idea is to introduce a character, like depending on the religion, we are going to introduce. Let us take an example, like if the case is an Hindu, let us assume Krishna as a small animated image in Diamond app, which will keep him going through verses with Bhagavad Gita. And if he is a Christian, we are going to introduce a guardian angel, which will keep him reminded of verses like your body is a temple, take care of it. Right? And like that, we are going to make it a culturally sensitive app too. And we are going to help the patient be in the positive feedback cycle. This will help the patients to be more adherent to the practices followed. And beyond this, we intend to conduct a pilot study within the government offices to take the feedback and develop the app in the best interest of users. Uh, this is the stigma and social nuances, and we are how we are going to deal with it. These are the references, and at the end, I would like to say that there are a lot of uh, apps, and there are a lot of apps and diagnostic modalities out there which try to solve this problem, but they don't establish an ecosystem as such. But we are going to establish an ecosystem where the patient is completely motivated by positive feedback and behavioral lifestyle. We are incorporating both psychological and behavioral changes along with science-proven diagnostic modalities. And that's why we think that diavin and salivate as a combination would be a great solution to detect and prevent and treat diabetic foot ulcers in the long run. Thank you. And if there are any doubts, feel free to contact me. I share the WhatsApp number within the description of this idea. Thank you.